Okay, guys, we're up to the upper limb. I'm going to divide it up into three separate parts. We're going to have a look at all of the components that you're required to know for the shoulder, then look at the elbow, and then look at the wrist and the hand. As far as what you need to know goes, it's essentially just telling you exactly that. We're looking at the bony landmarks for each of those particular regions, the shoulder, elbow, wrist and hand, as well as the major muscle groupings that you need to know for each of those particular areas as well. Okay, so I'm going to start out by having a look at the bony landmarks of the shoulder. All right, so what you're looking at there is the sternoclavicular joint. So looking anteriorly at the sternum and the clavicle. So the sternoclavicular joint is where the clavicle inserts into the sternum, where that pink line is. You can locate it by palpating medially along the clavicle and feel the depression where the clavicle inserts into the sternum. As much as you can self-palpate as we go along doing all of this, whether it's muscles or bony landmarks or both, then the better off you're going to be when it comes time to put all of this actually into practice. Okay, then we're looking at, and I apologise for having to move the insert around here, but I'll need to do that depending on where there is room for each particular slide. So now we're looking at the clavicle shaft. So sternoclavicular joint is here, and so the clavicle, the shaft of the clavicle runs, laterally and then supero-posteriorly right up until where it meets or joins with the with the acromion, which then probably leads me to the acromioclavicular joint. So this is a clavicle here, and this is the acromion here. So, of course, where the two join is referred to as the acromioclavicular joint. So found where the lateral clavicle meets the acromion itself. The acromion, all right, now this is a posterior view. And so we're looking at, this is the scapula, this is the humerus here, and this is the spine of the scapula. So we're posterior, and this is the clavicle, which is obviously anterior. So where the clavicle joins with the, or at the acromioclavicular joint, it actually forms a landmark with the scapula, specifically the acromion of the scapula. And as I've said there, it's a flat corner landmark at the top of the shoulder. Coracoid process, again, I think we've got an anterior view here. So we're looking at the inferior aspect of the scapula. So this is where the scapula sits against the rib cage. And this is the clavicle anteriorly, right? So, and this is the humerus anteriorly. So this is an anterior view. Now, the coracoid process is a part of the scapula, but projects anteriorly from the scapula itself. So if you palpate deep to the deltoid muscle, so we're anterior, just inferior to the clavicle, you should be able to palpate that bony prominence. And that bony prominence is referred to as the coracoid process. Okay, so now we're looking at the greater tubercle of the humerus. So again, we've got an anterior view, and we're looking at the inferior aspect of the scapula, right? Inferior or anterior aspect of the scapula. And this is the clavicle anteriorly. We've looked at the acromion. This is the acromioclavicular joint, and this is coracoid process. On the humerus itself, there are two significant projections superiorly. One is the greater tubercle of the humerus, and the other one is the lesser tubercle of the humerus, yeah? Now, they have significance because of some muscle attachments, which we are going to look at in a moment. In between the two, so remember I said there is a greater tubercle of the humerus, so we're still looking anteriorly. There's a lesser tubercle of the humerus. Well, in between the two, there is this groove, and that groove is typically known as the intertubercular. Makes sense, doesn't it? Inter means between, so between the two tubercles, intertubercular groove, also known as a bicipital groove. And the reason is because of the presence of biceps tendon. We'll look at that in a moment. So with the arm in slight internal rotation, right, so from the anatomical position, you're theoretically meant to be able to palpate that intertubercular groove. Now, having said that, it can be quite challenging to do so. So we're looking at greater tubercle, lesser tubercle, and then in between the two is the intertubercular groove. Looking at the scapula here, it's a posterior view of the scapula, and we're looking at the right scapula, posterior view. And we have what's referred to as the spine of the scapula going up to the acromion, which we've talked about. And we talk about the superior border of the scapula, the superior angle, the medial border of the scapula, the inferior angle, the lateral border, and the lateral angle. All right, so scapular spine, spine of the scapula, the borders, superior, medial, and lateral. Yes, lateral, sorry, we're looking at a right scapula here, but we're looking at a posterior view, and the angles. So superior angle, inferior angle, and the lateral angle in here. Again, I think we've got an anterior view. Yes, we do. We're looking at the glenohumeral joint, and it's where the head of the humerus makes an articulation with the scapula, right? So this is the humeral component. This is referred to as the glenoid fossa, or the glenoid cavity. Hence, where the humerus joins with the scapula, we'll refer to that joint as the glenohumeral joint. Okay, let's, the next one. So I thought we were on to muscles, but we're not. The other so-called bony landmark of the shoulder is the scapulothoracic joint. And, of course, it is as it sounds. It's where the scapula articulates with the rib cage underneath, right, the thorax. And that's meant to be delineated by this green shading here. But here's the thing, it's not a true joint. Oh, that's where it says it here. It doesn't qualify as a true joint. And the reason is because there's no actual joint itself. It's really just the scapula that sits on and moves across the actual thorax itself, the rib cage, depending on which muscles are contracting. So it's not a true synovial joint because a true synovial joint requires two articulating bony surfaces, and they're not really. This is sitting on top of the rib cage, but there's no real articulation. There's no real joint formation between both the scapula and the thorax. And of course, as you well know, a synovial joint has a synovial membrane and it has articular cartilage covering the bone ends, and it doesn't in this case. So neither the scapula nor the thorax in that location actually has any cartilage associated with it. So we talk about where the scapula joins with the thorax as being a joint, but it's not a true joint. And I've gone through and explained those regions. Now let's have a look at the muscles that are acting on the shoulder. But one of the first things that we need to be clear about is the actual movements. When we talk about elevation and depression and retraction, what are we actually talking about? Well, elevation is as it sounds. It is the upwards movement. So this is meant to be a posterior view. It is the upwards movement of the scapula. Depression is the downwards movement of the scapula. Retraction is movement of the scapula towards the midline. All right, so up, down, and towards the midline. Protraction is movement of the scapula away from the midline, right? Away from the midline. Lateral rotation, and this is important, lateral rotation is a reference to the inferior angle of the scapula moving away from the midline. Now, because of the axis of rotation, and we'll talk bit more about that. Well, maybe not in this subject, but you'll get that along the way because the axis of rotation in that plane, so we are in a coronal plane, the axis of rotation, the pivot point, is located centrally within the scapular mass. And as a result, when the inferior angle moves away from the midline, it actually results in rotation of the scapula from the glenoid fossa, or glenoid, from the acromion, upwards and inwards. So the inferior of the angle of the scapula moves away from the midline, and the acromion actually moves up and in. And therefore, so that's lateral rotation. Medial rotation is the other way around, right? So the angle of the scapulas are moving towards the midline, but the acromion is moving laterally and inferiorly, all right? Might need to have a look at that to get your head around it in a bit more detail. All right, so now we're looking at muscle actions on the scapula. So you know what elevation, depression, retraction, protraction? Well, actually, we mightn't have done retraction and protraction, did we? Yeah, we did. So retraction is movement of the scapula towards the midline. Protraction is movement of the scapula away from the midline. When we have a look at the muscles, and you need to remember these, that elevate, depress, retract, protract, medially rotate, and laterally rotate the scapula, then it is the upper trap and levator scap, which elevate, the lower trap and pec minor, which depress, rhomboid major and minor and middle trap, which retracts, protraction, right? So movement of the scapula away from the midline is serratus anterior and pec minor. Medial rotation of the scapula, and so we've got the inferior angle moving towards the midline, rhomboid major, minor, levator scap and pec minor. And then lateral rotation, that inferior border moving laterally away from the midline, that's upper trap, lower trap and serratus. Now, you do need to be able to commit these to memory and have an understanding about which muscles are responsible for which actions. All right, now let's go on and have a look at what are called the sits muscles. The sits muscles are also known as rotator cuff, and it stands for supraspinatus, infraspinatus, teres minor, and subscapularis. Now, they're attaching into the upper aspect of the humerus. So I'll say it again. We're going to look at these in a bit more detail in a moment, but those four muscles all attach into the upper aspect of the humerus. And as a result, they're referred to as sits muscles, supra, infra, teres minor, and subscap, all inserting in a similar location. I've drawn that pink line around it. Now, this is a posterior view of the humerus, he says, getting his head around it. Yes, it is. All right, so this is the clavicle, this is the scapula here, and this is the insertion point. Now, as you can see, so infra and teres minor, infraspinatus and teres minor sit on the scap. So they're posterior, and they insert into the upper aspect of the humerus. So I am sure you can see that when they contract, they will externally rotate the humerus. They will externally rotate the humerus. Excuse me. Whereas supraspinatus, because of the its angle that it takes from the upper part of the shoulder, and we'll look at that later, and down into the insertion point here, its primary role is abduction of the humerus. And then finally, subscap attaches or comes anteriorly and attaches towards the posterior aspect of the humerus. And as a result, as you can see, it will internally rotate the humerus. Now, if we're going to move to the anterior part of the humerus and have a look at where these insertion points are, and it can be a little bit confusing, and I apologise about that, but it's important to remember that, believe it or not, this is the posterior view, and in this view, the humerus has been rotated externally, right? So external rotation for you to be able to visualize it, which can make this picture then a little bit confusing because it looks as if that and that are the same position, but they're not. This is a posterior view. This is an anterior view. But in this posterior view, the humerus is rotated externally, and as a result, you get to see the insertion points of the sits muscles from a posterior perspective. But if you were to rotate the humerus into its anatomical position and then view it anteriorly, you would see that supraspinatus, infraspinatus, and teres minor attach on the greater tubercle of the humerus and subscapularis on the lesser, which is why, because if you have a think about it, we've got those other three muscles, supra, infra, and teres, coming from, well, supra is coming from almost a neutral position, but infra and teres minor are coming from a posterior location, and coming around and attaching anteriorly on the humerus. And as you can picture from that, when they contract, they'll externally rotate that humerus. Subscapularis is coming from under scap through here, right? And as a result, then it's going to rotate the humerus internally. All right, so let's look at them individually. So supraspinatus origin is the subscapular fossa of the scapula, right? So it's on the scapula. It's in the, suprascapular, above. Supra means above. Scap, the spine of the scap. So that's suprascapular. And it inserts into the greater tubercle of humerus. Because of its angle from origin to insertion, it initiates glenoid humeral joint, GHG, abduction, all right? So abduction of the glenohumeral joint or the humerus. Infraspinatus is in the infraspinous, below the spine of the scapular fossa, and goes into the middle facet, and we looked at that in the previous slide on the greater tubercle of the humerus, and as a result is an external rotator. And then finally, when we're looking at those posterior group muscles, the teres minor, lateral border of the scap, again, we're looking posteriorly here into the posterior surface of the greater tubercle of the humerus, and again, that's going to be internal rotation, which then leaves for the last one, subscapularis, right? And so this is the, if we're looking at the body anteriorly, right, looking at the body anteriorly, then this is the anterior aspect of the scap. It's the underneath of the scapula, for want of a better phrase. The underneath of the scapula, for want of a better phrase, inserting into the lesser tubercle. And of course, I'm sure you can see if that muscle contracts, it's going to internally rotate the glenohumeral joint. Pec major, I'm sure you're really familiar with. We talk about the different fibres, the superior, the middle and the inferior fibres, but the reality is it's attaching to the clavicle, it's attaching to the sternum, it's attaching to the ribs as well, and it goes into the lateral lip of the intertubercular groove, or sulcus is another name for it. And we talked about that bony landmark before. Now, as a result then, I'm sure you can picture it's definitely going to internally rotate the humerus, but it also flexes the humerus as well, and then brings the humerus towards the midline, referred to as adduction or adduction. Moving posteriorly, we've got latissimus dorsi, and as you can see, it's going up into the floor of the intertubercular groove or sulcus of the humerus. And its origin, you can see it's huge muscle, isn't it? So we're looking at spinous processes of T7 to 12, and then the supraspinous ligaments, which we've talked about, the inferior angle of the scapula, the thoracolumbar fascia. This is the thoracolumbar fascia down here, and into the iliac crest down here, and also ribs 9 to 12. So you can see its origin is really significant, and its insertion point is into the floor of the intertubercular sulcus or groove of the humerus. Now, as I'm sure you can see, it's going to extend the glenohumeral joint, in other words, bring the humerus back towards us in the screen. It will adduct the humerus towards the midline and also, obviously, internal rotation. Teres major, we've already looked at teres minor. Teres minor sits up here, although I think I whacked in a second time, but we'll see in a moment. Teres major from the posterior surface of the inferior angle of the scap, and it's going into the medial lip of the intertubercular groove, and therefore it's going to internally rotate the glenohumeral joint. The deltoid, we talk about anterior, middle, and posterior fibres, and so it does a range, and it inserts into the deltoid tuberosity, which is a bony prominence in the proximal aspect of the humerus. And depending on which deltoid fibres, anterior, middle, because this is a posterior view, anterior, middle, or posterior contract, it will do different things to the humerus. Together, there's typically glenohumeral joint flexion. So, I apologise, anterior is going to flex, posterior is going to extend, and middle is going to abduct. I'll say that again. The anterior fibre is going to flex the humerus. The posterior fibre is going to extend the humerus, and the middle fibres are going to abduct the humerus. Biceps brachii, I'm sure you're familiar with that. It's called biceps because there are two heads, and in this case, both proximal and distal. And you can see why the bicipital groove is referred to as the bicipital groove here. So greater tubercle of humerus, lesser tubercle of humerus, and one of the heads of biceps runs through that intertubercular or biceps groove. So the origin, we talk about a long head to the supraglenoid fossa, supraglenoid tubercle of the scap and the glenoid labrum. So that's this head here. And the short head to the coracoid process. That's the coracoid process there. Now, it goes down into two locations. One is into the radial tuberosity, which is on the radius. And the other one is into the fascia of the forearm. You can remember it as fascia of forearm. You don't need to worry about this. So it does a range of different things. It obviously flexes the glenohumeral joint because it crosses the glenohumeral joint. It also flexes the humeroulnar joint, so humerus, and well, I can't really see the ulnar here. We've got more of the radius, but it flexes this joint. And also, if it's the shorter head, this head, which inserts into the fascia, if the shorter head contracts, it will supinate. Now, supinate means turn out. So I'll use my right hand. It means turn out. You probably can't get that all that well, but if you turn your palms away, that's supination. If you turn your palms in, that's pronation. And if this short head contracts, it'll supinate. Coracobrachialis is as it sounds. It's from the coracoid process to the proximal, or in this case, medial 1/3. So it's the upper 1/3. Sorry, I apologise, middle 1/3 of the humerus, and it flexes the glenohumeral joint and also adducts, brings the humerus towards the midline. Triceps is posterior, so spine of the scap. You know, we're posterior. We've got two heads proximately, a long head, three heads, a long head, which goes into the infraglenoid tubercle of the scapula. We have got a lateral head, which is the upper 1/3 of the posterior humerus, and the medial head, which is the distal 2/3 of the posterior humerus. Into the olecranon process of the elbow. So I'm sure you can see what the primary function of this is. It's extension of the elbow, which is made up of both the humeroulnar, so the humerus and the ulnar, and the humerus and the radius, right? So it extends the elbow, the humeroulnar and the humeroradial joint. All right, I'm going to leave it there, folks, and we'll move on to the elbow next.